Good afternoon, National Museum of American History and Smithsonian colleagues, and welcome to the Smithsonian Staff Learning Series hosted by the National Museum of American History. The goal of the series is to explore the trends, topics, and research relating to the public so that we may better understand our current and future audiences. My name is Adam Rozan, and I'm the Director of Programs Audience Development at the National Museum of American History and your host and moderator for the series. For today's talk, we'll explore the topic of early childhood education with Allison Friedman-Krauss of the National Institute for Early Education Research, or NIEER, who will share insights on young learners, including preschoolers, their educators, and related audience information from the National Institute. Our speaker today is Allison Friedman-Krauss. She is an assistant research professor at NIEER and leads NIEER's policy team. Her research focuses on early care and education policy, child development within the context of early childhood education policies and programs, early care and education quality, and the early childhood education workforce. Dr. Friedman-Krauss received her Ph.D. in Developmental Psychology from the Steinhardt School of Culture, Education, and Human Development at NYU. And special thanks to our former early learning colleague, Carrie Heflin, for encouraging conversation on early learners and her support throughout its planning. Please note that this discussion is being recorded with closed caption, and I'll be helping our speaker by moderating the chat. Please add your questions there. And lastly, I'd like to hear from you. So please take a moment today or tomorrow and share your thoughts on the series, past speakers, and share your ideas for the future. Thank you. And with that, I'd like to turn over the slides to my colleague, Allison, please.
Sorry
Allison,
about that.
you're muted.
Sorry about that. Thank you so much for that introduction, and thank you for inviting me to talk with you all today. I am an assistant research professor at the National Institute for Early Education Research, or NIEER. We're part of the Rutgers Graduate School of Education. And as Adam mentioned, I'm going to be talking about the state of early childhood education today. Please, I welcome any questions. If they come in during the presentation, Adam, just please let me know. I probably won't see them. Okay, here we go. So the 6 things I'm going to try to get through today is first just talk about the complex nature of the early childhood education landscape and how it has or has not changed over the last 2 decades. This will include a specific look at state-funded preschool programs, Head Start and Early Head Start, early intervention, early childhood special education. Then I'll turn to results from a national survey that NIEER did of parents of preschool age children about the impacts of the COVID-19 pandemic on children's early learning, both in the house and in terms of participation in early childhood education programs outside of the house. And then I'll conclude with a brief discussion about where we think the early childhood education landscape is headed. What's next? So with that, I'll start with the overview of the early childhood landscape. And for this part of the talk, I'm really focusing on programs for children ages 3 and 4 years old, those children in the 2 years prior to kindergarten. But as you'll see, most of the children in these programs are actually 4-year-olds, and a lot of the programs focus more on 4-year-olds and don't have access for 3-year-olds nearly as much as 4-year-olds. This pie chart is an attempt to show the sort of complex, diverse nature of the early childhood education landscape. For 4-year-olds, the pie chart would look similar in terms of the types of programs for 3-year-olds, but the numbers would be a bit different. So first we have state-funded preschool programs, which are programs that are funded by and administered by states. Those are very diverse in how they look in each state. Like New Jersey's program is very different than DC's program, which is very different than Florida's program. And a few states don't have any state-funded programs. And then we have the federal Head Start program, which is this middle blue bar pie slice, and then our early childhood special education in the light blue. And these numbers are unduplicated, so a child is only counted once if they're enrolled in more than one programs. Where it gets a little bit more complicated is this green slice, but we call other none because we don't really know how to break it apart. Some of the children in that 61% are not attending any type of early childhood program during the year before kindergarten, but a lot of them are. They might be in locally funded or district funded or city funded preschool programs that are not captured by our state of preschool surveys. things like the Boston Preschool Program, which is not a state-funded preschool program in Massachusetts. It's funded by the city, or just districts funding children independently. And then there's also private childcare, both private childcare paid for by parents and private childcare that children access using childcare subsidies. So this is just to show that the early childhood landscape is pretty varied. There's not just one preschool program, preschool childcare, it's sort of all a mix. And I think the important part of it is really understanding or making sure children have access to high quality programs, whatever we're calling it. So now I want to talk a little bit about how this has and has not changed over the last 20 years. And I'm going to start that by looking at data from the census data. This is particularly the October education supplement. And this is showing the combined picture for 3 and 4-year-olds. Unfortunately, the data is not able to be disaggregated by 3 and 4-year-olds. If it was, you'd probably see somewhat different pictures for 3 and 4-year-olds with higher numbers for 4s than for 3s. The big takeaway here is if you look at 2000 versus 2019 before the pandemic, we've only seen like a tiny little increase, 2 percentage point increase over 20 years, which is a little bit surprising given all the attention early childhood education programs have been paid in the last 20 or so years. You may have expected this to be a little bit higher. And then of course you see this pandemic dip, which we were all sort of seeing a lot, and a rebound through 2021. I bet when we see the fall 22 numbers, these numbers will be, back to where they were prior to the pandemic. So while this overall rate of participation in early childhood education programs has not changed over the last 2 decades, we have seen some changes. So we have seen this shift towards more children enrolled in publicly funded programs with this red line up here, compared to a decrease in the percentage of children enrolled in private programs, so those private childcare. The red line would include things like Head Start, like state-funded preschool programs, city-funded preschool programs. So we're seeing there are these greater investments by states and cities, and children are participating in those programs in higher numbers, but it's not necessarily that more children are being added, it's just that children are shifting in the type of programs they've attended over the last 2 decades. And we've also seen this shift between full day or part day to full day programs. So this green line, you see this decreasing trend in children participating in part day programs and more of an increase in the darker line in full day programs. And so again, if you can think about it, a full day program is essentially like 2 slots, 2 part day slots. So whereas one child could have been in the morning and another in the afternoon, a full day is taking up 2 slots. So that could be another possible reason we're seeing, hearing a lot about expansion of preschool and early childhood education programs and more money into the field, but not as much an increase in the overall percentage of children. And so again, this was a combined 3 and 4-year-old data. I think it would be great to have this data disaggregated by single year of age, but it's not available. So I wanted to look just at state pre-K and Head Start together, 2 publicly funded programs that NIEER collects data on this. So this is our own data, and this can be disaggregated by single year of age. So what we see here is that you see more of a steady increase. It does flatten off in the last few years. But when you look at the dark blue bars, which is state-funded preschool only, before the pandemic, you see those going up each year. And you sort of see Head Start, the light blue bars, flattening out. And what we've seen with Head Start is that they've had a focus in the last few years, again, on full day programs. So they're moving more children to full day programs, which is, more funding per child. And also a shift of their funding towards early Head Start, so programs for children under 3. When we look at 3-year-olds, I think the most striking finding is it's a lot lower than the 4-year-olds, and also basically no progress increasing access over the last 2 decades. Now I'm going to turn and talk a little bit just about state-funded preschool and give you more of like a spotlight on that. So NIEER, for the last 20 years, has put out our State of Preschool report, starting with the 2002 school year. It's the only state-by-state report that tracks access to or enrollment, funding for, and quality standards in state-funded preschool programs. So those are those programs that states are administrating and funding. They often do use a combination of state and federal and local funds. to provide the programs, but they do put some state money in and have to be controlled by the state. Our 20th report on the 2022 school year will be out in the next few weeks. So if you're interested, visit our website or sign up for our newsletter and you'll get that in your inbox. And this work is currently funded by the Heising-Simons Foundation and the Bill and Melinda Gates Foundation. I wanted to start with a comparison of how state-funded preschool looked 20 years ago and how it looked today. In 2002, 38 states had programs. Now we have 45 states, which includes DC. So there are 6 states that still do not have a state-funded preschool program. We've more than doubled the number of children enrolled in state-funded preschool program over 20 years, from under 700,000 to 1.5 million. Not so much progress again on 3-year-olds. We were at 3% and now we're still at only 6%. It's, not really moving anywhere fast. Progress has been better for 4-year-olds. We were at 14% 20 years ago when we started this, and now we're up to 32% with a high of 34% before the pandemic. States in 2002 spent $4.5 billion in 2022 dollars. So adjusting for inflation, we've doubled that in the last 2 decades. Where we haven't seen a change is the amount of money states are spending per child enrolled in preschool. We're still at just over at about $6,500 per child. There's been no change. I'll show you another slide. It's fluctuated a little bit over time. It's never gone higher, but we really want to see like double that. We think to fund a high quality full day program that pays teachers adequately, you need to be spending closer to $12,000 per child, maybe even more now with inflation. We've seen progress in the programs that are offering school day programs. So in 2002, it was 9, we're up to 20. And there's additional programs that offer like options that a child could enroll for or they provide half day or full day options. Of course, none of these programs are required. They're all voluntary. And then when NIEER has a set of 10 quality standard benchmarks, I'll get into that in a little while, but it's our sort of measure of quality in state-funded preschool. When we started tracking, no programs met all 10 of our benchmarks. This year, we have 5 states that meet all of them, and we've raised the bar on those benchmarks over time too. Just another look at the progress we've made in enrolling 4-year-olds in state-funded preschool. You can imagine maybe if the pandemic hadn't happened, we'd be above 35% up here at this point, but we're on our way back. Hopefully in the 2023 yearbook, we'll be fully recovered. Again, really no progress with the 3-year-olds. We've seen steadily funding has increased over the last 20 years. In the middle here, you see the effects of the 2009 Great Recession. It hit states like a little bit later, and it took a long time to recover, to come out of that recession in terms of states being able to support preschool. And these are all adjusted for inflation. And this is what I was talking about before. We've seen some fluctuations over time in what states are spending per child enrolled. Again, the lows really hit right after the Great Recession, where we dipped below $5,000 per child. But if you look, like, we're really right where we were 20 years ago. And again, that's not where we need to be. It's much lower than K-12, yet little kids are not any less expensive necessarily than K-12. I've talked a lot about patterns across time, but I want to show you how pre-K access really varies by state. And this is just sort of the tip of the iceberg here, showing the percent of children in each state enrolled in state-funded preschool, with the darker blues showing a higher percentage. So Oklahoma, West Virginia, for example, DC. DC is ranked #1 in access for 3- and 4-year-olds, as well as for spending per child. And then there's a handful of states in this lightest blue that don't even reach 10% of 4-year-olds. And the white states, Montana, Idaho, Wyoming, South Dakota, Indiana, and New Hampshire are our states that do not have a state-funded preschool program. When you look at 3-year-olds, access is really low everywhere. So the legend here is a totally different scale than the 4-year-old one, but it's really low everywhere other than in DC and maybe Vermont, Illinois and New Jersey, and maybe a few others crack 20% of 3-year-olds, but it's pretty low really everywhere you look. And these are the 10 quality standard benchmarks that NIEER, we assess each state program's preschool policies against these criteria. And these are research-based, and what we envision as like the minimum states need to do in order to maybe have a high quality program that supports children's development. We can't say that if you do all these things, it's guaranteed, but we'll say that if you're not doing this, it's going to be really hard to have a program that's supporting children in the ways they need to be supported to really learn and develop. So we are looking for a comprehensive early learning standards that sets out the different topics and domains that children need to learn and have those be aligned with what they're learning later when they transition into kindergarten. And if they were in an infant and toddler program, what they were learning and being supported with at a younger age. They're aligned with the curriculum, with any assessments that are going on in the program. When programs are selecting a curriculum, they have support from the state in something like a list of approved curriculum, as well as supports to implement that curriculum, like technical assistance, coaching. We're not looking for a specific curriculum or saying one curriculum is better or worse. We just want this programs to be supported in implementing and using that curriculum in the classrooms. We want to see teachers have at least a bachelor's degree or higher in early childhood education. There's a lot of research to show that this is really important. As well as all of the state-funded preschool evaluations that have shown long-lasting effects have had teachers with a bachelor's degree. Then we also require assistant teachers to have a child development associate credential or something equivalent. We don't want to see class sizes larger than 20 with one teacher per each 10 children. And programs should also be requiring either providing or making sure children get in somehow vision screenings, hearing screenings, and at least a few other health screenings. And if there's something that's positive, helping them refer to a provider. And the last benchmark is our continuous quality improvement system. We want to see programs data being collected on their programs, specifically structured classroom observations, where the data is then being used, it's being fed back to the state level and the program level to make quality improvement changes in the program, both at the local and the state level. Unfortunately, most children are not in programs that are meeting most of our benchmarks. So right now, it's only about 10% of children are in state-funded preschool programs or in programs meeting 9 or 10 of the benchmarks. What you can see is that unfortunately, several of the large programs like California's transitional kindergarten program, Florida, Texas, they meet less than half of our benchmarks. And that's a lot of the kids in state-funded preschool. So 11 of our programs meet less than half of the benchmarks, but that's covering 40% of children in state-funded preschool. We're also saying that not all of our programs have returned to pre-pandemic practices. There was a lot of waivers put in place, understandably, during the pandemic to keep everybody healthy and safe. But we haven't returned to normal yet in some of these policies in some of the states. And most concerning is this increase in teacher waivers. So we're seeing where states used to require teachers to have a bachelor's degree or still do require that bachelor's degree and specialized training in early childhood. They're allowing for a lot of waivers to that because they can't find staff. They can't find qualified teachers. They're allowing for long-term subs in the classrooms for a longer period of time who don't have to have the same qualifications as a teacher normally would have. And so that's definitely a concern. And we've seen this in a lot of states that more waivers than we've ever seen before. All right, now I'm gonna switch back over, and before I was talking about state-funded programs, I want to now talk about 2 federally funded programs. So Head Start and Early Head Start, and then I'll talk about early childhood special education, early intervention. So Head Start is a federally funded program. It's predominantly for young children from families who live in poverty. And this report was really focused on equity of access to Head Start and early Head Start, and was funded by the Robert Wood Johnson Foundation. It's NIEER's second report to look at Head Start state by state, but this one really focused on understanding who does and does not have access. We were able to look at, because of the timing, look at the impacts of the pandemic. We used data from the Head Start Program Information Report, which is something the Head Start programs are required to complete. It's a pretty extensive survey. They have to report on it every year, and it's some really great data that exists and is for the most part publicly available. You just have to request it. The data was not available from the 2019-2020 school year because of the pandemic. And we organized the report around these 4 themes, and I'll go through some of our results, interesting findings in this order. So just like state-funded preschool, there were some large impacts, negative impacts of the COVID-19 program pandemic on enrollment in Head Start. It was a 33% decrease nationwide. The states highlighted here had more than a 40% decrease. It was 250,000 children fewer enrolled in Head Start as a result of the pandemic. The good news is that we're seeing bounce back. They're not quite back to where they were before the pandemic, but they're getting there, just like we're seeing in state-funded preschool. When we look at early Head Start, and let me take a step back in case this is unclear. Head Start is a program predominantly for 3- and 4-year-olds during the 2 years before kindergarten. Early Head Start is a program for infants and toddlers. It actually starts with pregnant women, and it goes through when children turn 3. So we saw a 10% decrease here as a result of the pandemic, but there was a handful of states, the ones highlighted here, that did actually have small increases in enrollment. But the pandemic impacts were not equal for everyone in Head Start. So while we had that 33% decrease, it was larger for Black children. There was a 37% decrease for Black children in poverty, and only a 29% decrease for white children. We did not see a similar pattern for early Head Start or for Hispanic versus non-Hispanic children. The good news, I guess, is that funding for Head Start remains stable during the pandemic. So even though we saw this really big drop in enrollment and children accessing Head Start, funding remains stable. The number of funded slots and available seats for kids to fill was unchanged. And Congress also authorized additional supplemental COVID funding to help local programs, stabilize their programs, purchase materials, make, ventilation improvements and things like that. So really, I think that helped with the rebound we're seeing. Switching now to our poverty theme. This slide here shows the percentage of children living in poverty who attended Head Start between 2012 and 2021. The main takeaway here is that over the 10-ish years, we really have not seen the bar move. We started at 40%, we're up at 41%. At the same time, there was a pretty substantial decrease in child poverty. So you would have expected Head Start's reached, if they were serving the same number of children, to increase because the denominator, right? There's fewer poor kids, so the percentage should increase. But as I said before, more children in Head Start are being enrolled in full-day programs, and there's been a shift towards early Head Start in how the funding has been allocated. And so on the flip side, we do see this increase of 4 percentage points over the same time for early Head Start, went up from reaching 5% of children under 3 in poverty to 9%. It's still pretty low. It's still reaching less than 10% of children in the country, of poor children in the country. Funding for Head Start per child is lower in states with higher poverty rates. So poor states are getting less funding per child for Head Start. Some of this is because a lot of those poor states are serving more children. So they're stretching those dollars more than some of the other states. We don't see the same pattern in early Head Start. Actually, funding per child is higher in higher poverty states for early Head Start. Not really sure why this is happening, but it is one of our findings from the report. Turning to race and ethnicity, this is showing our national pattern of access of children in poverty. Nationally, 30% of children in poverty enrolled in Head Start. This was higher for Black children, lower for Asian children. Non-Hispanic children were more likely than Hispanic children to have access to Head Start at the national level. These differences are all statistically significant. We see sort of similar patterns for early Head Start. The differences are smaller, but they're still statistically significant. And while these patterns for Head Start and early Head Start are what we saw at the national level, it really varies across the state in the pattern. So some states are seeing similar patterns to this, and in some states it's like flip. So some places more white children than Black children are receiving or enrolled in Head Start or early Head Start. So it was sort of interesting that there was variation in this national pattern across states. Funding is a little concerning here that Head Start funding per child tended to be lower in states with a higher percentage of Black children in Head Start, a higher percentage of Black children in the state, and a higher percentage of teachers who are Black. A big part of our report just focused on how funding, enrollment, and lots of different program components vary state by state in ways that really don't make any sense. They're not necessarily related to characteristics of the state or needs of children in the state. So for example, when you look at per child spending between the highest and the lowest, there's a difference of $7,000. And this is after adjusting for cost of living in the state. Similarly for Head Start, for early Head Start, the difference is almost $8,000 per child. Now we are looking at variation in Head Start enrollment across the states. The darker states are serving a higher percentage of children in poverty. Mississippi, North Dakota, Montana are some of the highest. There's a 50 percentage point difference between those top states and some of those lower states in the lighter colors. Again, there's not really an easy explanation why this is happening. Similar variation for early Head Start. The difference is a little smaller, 33 percentage point difference between the top and the bottom states. We put out some policy recommendations for the Head Start program. Predominantly that more funding is needed to bring all of the states up to where the top states are. So if we think about the states, the top 5 states that are reaching the most children, let's bring all of our states up to where those are, to the access level of those top states. To do that, to do that while providing salary parity for teachers, which we think is a critical component here, would cost about $10 billion, which could be done over 4 years at $2.5 billion each. On top of that, there'd be another $2.5 billion annually to bring teacher salaries up for the current teachers in Head Start, which we know there's been a lot of attention in the field lately, just in general to early childhood educators, as well as teachers in general. But early childhood preschool teachers, Head Start teachers, childcare teachers are really underpaid and is really contributing to a lot of the shortages that states are finding in the workforce. I know there's a lot of information, so I'm going to switch now to early intervention and early childhood special education. Again, these are federal programs for young children with disabilities. And this is a report that will be coming out later this month. Also focused on state-by-state equity of access to these 2 programs. It's organized around 4 themes as well, and it's focused on the 2021 school year. One of the most shocking findings from this report is that access to both of these programs varies with state median income. So essentially, children who live in poorer states are less likely to have access to special education and early childhood and early intervention. And this really should not be the case. We're not sure why this is happening, but it's something that really needs to be addressed to ensure and to improve equity in the system. There are some states that buck the trend, that they stand out, that they're above that regression line. But for the most part, we're seeing this concerning pattern. There's lots of variation too across the states in where children are being served. So the Federal Individuals with Disabilities Education Act requires that children receive services in their least restrictive environment. Some states are much more likely to have provide services in inclusive environments than others. We see large differences between boys and girls as expected, that boys are about 2 times as likely to receive both early intervention and early childhood special education. I'll get back to the race finding in a minute. And again, variation across the state. For early intervention, there's about 10% of children in Massachusetts receive services compared to only 1% in Arkansas and Hawaii. We don't know what the right number is here, like what the prevalence is of disabilities, but it shouldn't vary by 10 percentage points across the states, most likely. Similar variation for early childhood special education, from 14% in Wyoming to only 3% in North Carolina, Texas, Georgia, Montana, and Alabama. And another really important finding to come out of this report is that a lower percentage of Black children compared to white children are receiving both early childhood special education and early intervention. But when you get to school age, this pattern flips. So why are Black children under-identified at a young age and over-identified once they reach school age? We don't know, but that just suggests that there's something likely inequitable about their access, particularly in the early age. And it could also mean that they're being over-identified at a later age. It's likely a combination of both. We do see that Hispanic children and Asian children are also less likely to receive services. The difference is smaller than for Black children, and also similar to the patterns we see once they transition into kindergarten and the school age program. The pandemic reduced access to early intervention, but it was disproportionate. So while there was an average of 15% decrease, this was much larger for Asian children and lower for white children. A different pattern for early childhood special education, which was much more impacted Black children than other groups. So we're recommending that a national commission, a national summit come to bring states together to talk about these issues, to try to problem solve for states that are doing things well, to bring examples and serve as models for other states and help states build more equitable systems that are, ensuring that all children receive the services they're entitled to. President Biden has proposed additional funding for special education in his budget, which we think would go a long way to help solve some of these problems. And better data is really needed, particularly around children's home language and their income. So we know, are the poor children in states getting services, or are they the ones who are being missed? And there's very little data right now on the cost of special education, as well as on what it should cost. All right, so we're getting towards the end. I know I've been talking for a long time. This last thing I want to talk about is a survey, NIEER's Preschool Learning Activities Survey, and this was work done by my colleagues Steve Barnett and Kwon-Ki Jung. It's a series of 5 surveys that were conducted beginning in the spring of 2020, right after the onset of the pandemic, and the last one was done in the fall of 2022. Each one was a survey of about 1,000 parents of children ages 3 to 5, not yet in kindergarten. It was done online, and the responses are weighted to reflect the national population. First, we'll look at preschool participation. This red bar comes from the National Household Education Survey to show rates at about 61% before the pandemic. It really plummeted in the spring of 2020. The dark blue bars are showing in-person preschool attendance, and the light blue bars includes in-person, hybrid, and virtual. So you can see it sort of increased with each survey, and by the fall of 22, back to where they were before the pandemic, which is great news. What's not as great is if you look at this broken out by income level for children, like in families making under $25,000 compared to over $25,000, you'll see with the dark bars that it has rebounded for the less poor families, but for those poorest families, they're still below where they were before the pandemic, which is lower than the wealthier families. So there's still room to grow there. I will also say that's a pretty small N for these lowest income families, so there could be some error in there as well. Most children were not in programs because their parent was at home, but there's still some concern about the COVID exposure. We also asked parents about activities they were doing at home with their children, and this was initially intended to really understand, what parents were doing to compensate for children being home and not in preschool programs. And you think things have moved a little bit over time. I think what Steve's really interested in understanding is before the pandemic, at the beginning of the pandemic, about 85% of parents, so this darkest blue bar, this is before the pandemic, 85% of parents were reported that they were reading on a daily basis to their children. Why has it not gone back up yet? Why is it still so low? Or why has it been going down to 74%? We don't really understand why this is. Kids are back in school, but they were in school before when it was higher. So as a parent of a preschooler, I think it maybe has to do with parent burnout and stress, but we don't really know why we're seeing that, but it's an interesting finding. This is looking at the reading to a child, again, just at one time point in the fall, and it's interesting, this gradient is pretty consistent, that with higher parent education, you're more likely to be reading to a child. It doesn't necessarily explain the decrease we're seeing, but it's another interesting point just to note that more educated parents are the ones who are more likely to be reading consistently to their children. All right, I'm going to start wrapping it up. So what's next? Where is the field going? Last year, if I was doing this talk to you at this time, we were really hopeful that the Build Back Better legislation would pass and dramatically alter the early childhood landscape nationally by infusing more money. And we're really not as optimistic right now that that's going to happen, or any major federal initiatives to expand preschool. But we are seeing a lot of states taking things into their own hands and committing to move towards universal preschool on their own. So the darkest blue states here are the ones that already sort of have universal preschool for 4-year-olds. DC and Vermont have it already for 3-year-olds as well. But these states in the lighter blue, California, New Mexico, Colorado, Hawaii, Illinois, Michigan, and New Jersey, are all these new states that are stepping up and saying, we're going to do universal preschool in our state for 4-year-olds, and in some cases for 3-year-olds. If these states can do it, if they can implement high quality preschool to all the 4-year-olds in the state, those states cover almost 25% of all 4-year-olds in the country. So that's going to really move things forward. It's also going to set up new models for other states to learn from and potentially use and implement in their own states. So there is some optimism that the field is moving, that more children are going to have access to high quality programs, but it really does remain to be seen. So just to sum up, we talked about how diverse the early childhood education landscape is, the lack of progress in some regard for the last 2 decades, inequalities in who is and accessing programs, and the hope that we are seeing in these 7 states, but also a need for federal investments to really move things forward nationally. And with that, thank you for bearing with me during all of this.
It's a lot of material. So
Yeah.
Thank you for covering all those reports. Let's jump into questions. We have 2, but I know we have a lot more to discuss with you, and we've got 20 minutes. What is the role for museums in helping to bring early childhood education to everyone and really help with that equity gap across the country? What's the role for us?
Again, I have a almost 5-year-old and I have a 2.5-year-old, and it's been great getting back to museums with them after, not going because of my COVID fears for a while, but they learn so much. They love, I think a lot of the hands-on activities are so great for them. And then they bring that back to the classroom, they bring that back to home, and they ask questions and they read books about them. And I think, the Smithsonian's are great because they're free, but in so many places, we're paying $100 to get a family of 4 into a children's museum, and that's not equitable. That's not accessible to a lot of families. So, outreach to the communities who maybe are less likely to attend, I think would be really important.
So continue to do museum work, find ways to break the pay gap for in communities where museums have to charge, and do that outreach. Are you seeing other areas where museums, maybe even libraries, are filling in the gap and filling in these areas for 3-year-olds, 4-year-olds, and even the younger children, 0 to 2?
Yeah, I think, again, like the local libraries, a lot of it depends on their funding, and most likely the libraries in lower resource neighborhoods may not have as much access to programs, but just ensuring all libraries have books available to all age children, trying to get kids have story time for infants and toddlers, not just starting at 3 or 4, but starting with babies, getting them in the door and loving books from an early age, I think is really important and helpful to just build a solid foundation for learning from, as early as the parents will bring them.
That's great. My colleague Drew asks, how do you define read to child and told a story? The dip and rise in the two respective activities correlate.
Sorry, can you repeat that? Or is it in the
How are
chat?
you defining in the presentation the defining read to child and told a story? What are those two?
Yeah, so I think, again, I'm not all that involved in that work, but a read a story is more about reading a book to a child versus telling a story is just like orally or however communicating with the child, telling a story that you made up or that maybe you didn't make up, but not with the physical book or I guess an electronic book. But I think it's like a fine line distinction, but it's more about just the oral communication without having necessarily the book there.
Great, this is a variety. My colleague Drew also asked another good question here. Were state-supported deaf schools included in the survey of special education and participation rates?
The special education report wasn't a survey. It was mostly relying on the federal IDA data set. So it includes all children who received special education services through IDA had an IEP or an IFSP. When in the full report, we do break that out by disability type. So deaf children would be involved. We didn't specifically survey schools or anything for that report.
Okay. And how are you defining high quality programs so that we can ensure that universal pre-K is universal high quality pre-K? Great question, Emily. Thank you for asking.
Yeah, at NIEER, we mostly define that based on our 10 quality standard benchmarks. I would also add that a full day program is more likely to be beneficial because children are there for longer. A full day high quality program meeting those benchmarks, and also a program that is providing salary parity and adequate compensation for teachers, I think is really important. But we really do define it based on those benchmarks.
Great.
There's lots of ways to define it, but that's how we do it at NIEER.
My colleague Megan asked, what would be a good medium for the Smithsonian to engage with early learners? Short virtual trips or history-centered story time, working with partner museum to reduce barriers to access museums, bring content to children through at-home projects or crafts like Kiwi Create, but for history?
I think in person is always better than virtual, whether that's somebody from the museum going to a library or preschool and bringing it to them, or bringing the kids into the museum. Hands-on is great. I think the idea of the at-home activities is also great. The virtual, obviously it's easier to reach more children, but for the youngest learners, I think that's less effective medium that would work better for older children, but not so much for the younger children, unless you're Blippi or something like that. But I think the on-person, hands-on, tangible things are better for the youngest children. Great.
And tell me, what information do you have for us? What thoughts or guidance from yourself or from NIEER on how we as the Smithsonian Museum practitioners can work with teachers, the early childhood educators, and those in that space? What's our role there, and what can we do?
I think there's lots of different things you could do, and starting with potentially a focus group of teachers to find out what would be the most useful for them. I hate to speak for them because I think they have so many great ideas that I shouldn't be the one telling them, but working with them to co-develop ideas that they could do in their classroom, or, if there's field trips to the museum, then extension activities that they can build on, either preparing the children for the visit and, pre-learning, or building on what they learned once they go back to the classroom.
Great. My colleague Emily from the zoo offers a great reference where they're doing some good starts with Head Start. And then she asked, has there been any research about specific PD content interventions that are most needed across the early childhood education landscape?
Specific, that's a good question. There has been some research on different types of professional development. I'm not sure if it addresses like what's most needed. It's more been about evaluating different professional development. And I'm not super familiar with it, but I know there's some research showing like professional development with teachers to help them learn about children's social emotional development and give them skills to deal with behavior problems has had some positive impacts on both the teachers, but also the children. There's some research on specific training teachers are getting on math curriculum, learning math, and having like how that impacts children's learning. But I'm not super familiar with like the specific modes of, or like, I'm not super familiar with the literature. I think what we do know though is like, in addition to going and sitting in a room or watching on Zoom now, professional development, lecture type things, like hands-on coaching is a really effective tool where you have a coach who's in the classroom with you, who can give you direct feedback and help guide the teachers. I think that's definitely one, the research proven.
Great. And what do we know from NIEER on the family dynamic, the adults in the picture for these children? What do we know about them from your research that you can speak to?
We haven't done that much research about the parents. We've been, there may be some information in the survey, parent survey I presented about parent stress, but I don't have those results off the top of my head. So I'm happy to follow up with you on that after, if that would be helpful. We've asked parents more about like why they're not using childcare, why they are using childcare, but less so about themselves.
Okay. And so what did you learn about why they are or why they aren't using types of care?
It's changed over time. And this work is mostly focused in New Jersey. Or initially when we started doing the surveys, they were really worried about the pandemic because we started at the, in the height of the pandemic. A lot of it's that they're working from home. I think we're seeing a shift to parents that are just trying to work from home while their kids, they're working remotely, trying to balance the two things. Sometimes parents can't find care, they can't afford it is a high one. It's expensive. And if, you don't have access to subsidies and you sort of fall in that middle income world where you don't qualify for things but you can't afford it, it's just hard to afford. It is a big one.
Sure. My colleague Ann asks, are there ways that DC and other states that have had universal pre-K for a longer amount of time can help support other states? Great question.
Yeah, so we definitely, my colleagues have done some work where they bring leaders in the states together to form like communities of learning, where they'll, have leaders from DC, for example, along with leaders from other states who are not as far along to talk with each other, to learn from each other. I think that happens informally too. We know like there is a new program, a new state-funded preschool program in North Dakota. When we talked to them about it, they're like, yeah, we're modeling this after Alabama. We've been talking to Alabama about their, high quality preschool program. So I think some of that is happening already, but trying to bring those states together more often. There's also a national organization for the state leaders that does try to help bring them together and provide supports for them and connections.
Great. And what are some of the ways that you all, outside of trying to advocate for policy change and information with these reports, what are some of the ways that you work directly with states, with teachers, with the community to raise awareness and advocate for early childhood education and advancement?
Yeah, so we do a bunch of things. So just NIEER is a research institute. So everything we put out is research based. And while we intend for our research to be used for advocacy, we ourselves are not advocates and we can't be advocates. So we try to get all our reports out to the hands of advocates to use to do their thing. But we do, we provide technical assistance to states. States reach out to us all the time when they have questions about how to change their standards, how to improve policies in their states. And, we'll talk them through it. We'll help them work through it. Maybe we'll connect them to another state or provide examples with other states. We've done, just depending on, the project at the time, we've done interventions or help support teachers in implementing new ways of learning, like supporting kindergarten teachers to focus on play, for example. So it varies. From time to time. We work with coaches, sometimes districts. We do a lot of work in New Jersey with the districts. We'll do, collect data for them about their programs and then have meetings with them to feed it back to them and help them interpret it and how they can use it to improve quality in their districts.
Great. Well, other questions for our guests before we start to wrap up? Nope, we have a question that came in. We know there are a lot of different curriculum models and companies out there for ECE, and that ECE specifically needs to be flexible. But are there any models out there that you feel support the benchmarks? Thanks, Emily.
So when we assess our curriculum support benchmarks, we're not talking about a specific curriculum. We're really about making sure that states are supported in implementing it and making sure they're implemented well. I know there's there's a National Academies of Science group right now working to try to answer that question and to figure out what really is a high quality preschool curriculum, what that looks like, what out there might fit that criteria. The research is really mixed right now. There's been, certain studies show, there's been evaluations of tools of the mind, for example, that have shown it has positive impacts on children. And then there was one in Tennessee that said it didn't work. There's more attention being drawn to math specific curriculum versus sort of general curriculum. So I don't know if I'm really answering your question other than to say I don't really know, but people are really interested in finding out the answer.
Important one to solve. Well, Allison, the absolute pleasure. A lot of information. Thank you so much for taking the time to present today and walking us through 5 reports. And I'm sure my colleagues, I look forward to seeing these additional reports come out that you mentioned, and I certainly will be paying attention to it. And I appreciate you presenting, and I appreciate everyone for joining today's interesting conversation as we learn more about early childhood needs, education, and how to support 3- and 4-year-olds in that area. So thank you so much, and thanks everyone for attending.
Thank you for your